Heart valve disease is a complex heart disorder that, if left untreated, can lead to many other problems. This video will cover the major causes of heart disease. Hello friends, welcome to Dr. Osman's EduTrends. Myself, Dr. Osman, believe that you all are doing well and taking best care of yourself and staying home safe. Friends, heart valve disease occurs when your heart's valves do not work the way they should. Your heart valves lie at the exit of each of your 4 heart chambers and maintain one-way blood flow through your heart. The 4 heart valves make sure that blood always flow freely in forward direction and that there is no backward leakage. Blood flows from your right and left atria into your ventricle through the open mitral and tricuspid valves. When the ventricles are full, the mitral and tricuspid valves shut. These prevents blood from flowing backward into atria while the ventricles contract or squeeze. As the ventricle begins to contract, the pulmonary and the aortic valve are forced open and the blood is pumped out from the ventricle through the open valves into the pulmonary artery towards the lungs, aorta and the body. When the ventricles finishes contracting and begins to relax, the aortic and pulmonary valves snap shut. These valves prevent blood from flowing back into the ventricles. This pattern is repeated over and over, causing blood to flow continuously to the heart, lungs and the body. Now let us talk about the causes. Heart valve disease can develop before birth, that we call it as congenital, or can be acquired sometimes during one's lifetime, and we cannot say how it is caused. But sometimes the cause of valve disease is unknown. If we talk about congenital valve disease, most often affects the aortic or pulmonic valve. Valves may be the wrong size, have malformed leaflets, or have leaflets that are not attached to the annulus correctly. Bicuspid aortic valve disease is a congenital valve disease that affects the aortic valve. Instead of the normal 3 leaflets or cusp, the bicuspid aortic valve has only 2. Without the 3rd leaflet, the valve may be stiff, that is unable to open or close properly, or it may be leaky or not able to close tightly. If you talk about the acquired valve disease, these includes problems that develops with valves that were once normal. These may involve changes in the structure of your valve due to a variety of diseases or infections, including rheumatic fever or endocarditis. Rheumatic fever is caused by an untreated bacterial infection, usually which comes from the throat infecting bacteria. Luckily, the introduction of antibiotics to treat this infection has dramatically reduced the number of infections. The initial infection usually occurs in children, but the heart problems associated with these infections may not be seen until 20 to 40 years later. At that time, the heart valve become inflamed, the leaflets stick together and become scarred, rigid, thickened and shortened. These leads to mitral regurgitation. Endocarditis occurs when germs, especially bacteria, enter the bloodstream and attacks the heart valves, causing growth and holes in the valves and scarring. This can lead to leaky valve. The germs that cause endocarditis enters the blood during dental procedures, surgery or intravenous drug use, or with severe infections. People with valve disease except mitral valve prolapse without thickening or regurgitation or leaking are at risk for developing this life-threatening infection. There are many changes that occur to the valves of the heart. The papillary muscles can stretch or tear. The annulus of the valve can dilate, it may become wide, or the valve leaflets can become fibrotic, that is stiff and calcified. Mitral valve prolapse is a very common condition affecting 1 to 2% of the population. Mitral valve prolapse causes the leaflets of the mitral valve to flop back into the left atrium during the heart's contraction. Mitral valve prolapse also causes the tissues of the valve to become abnormal and stretchy, causing the valve to leak. The condition rarely causes symptoms and usually does not require treatment. Now, if we talk about the symptoms, shortness of breath and or difficulty catching your breath, you may not notice this most the time and when you are active doing your normal daily activities or when you lie down flat in bed. You may need to sleep propped up on few pillows to breathe easier. Weakness or dizziness. You may feel too weak to carry out normal daily activities. Dizziness can also occur and in some cases passing out may be the symptom. Discomfort in your chest. You may feel a pressure or weight in your chest with activity or when going out in cold air. Palpitations can happen. This may feel like a rapid heart rhythm, irregular heartbeat, skip beats or flip-flop feeling in your chest. Swelling of the ankles, feet or abdomen, which we call it as edema. Swelling may occur in your belly, which may cause your belly to feel bloated. Now, if you talk about the treatment for heart valve disease depends on the type and severity of valve disease. There are three goals of treatment of heart valve disease. First of all, protecting your valve from further damage. Secondly, lessening symptoms. And thirdly, repairing or replacing the valves. Protecting your valve from further damage. If you have valve disease, you are at a risk of developing endocarditis, serious condition. People who have mitral valve prolapse without thickening or regurgitation or leaking are not at a risk of developing endocarditis. You are still at a risk for developing endocarditis even if your valve is repaired or replaced through surgery. To protect yourself from more damage, call your doctor if you have symptoms of any infection. That may be sore throat, general body aches or fever. Take good care of your teeth and gums to prevent infections. See your dentist for regular visits. Take antibiotics before you undergo any procedure that may cause bleeding, such as any dental work, even normal basic teeth cleaning. Invasive test, any test that may involve blood or bleeding, and most major or minor surgery. Your doctor can provide you with a card that provides specific antibiotic guidelines. If we talk about medications, your doctor will prescribe you medications or medicines according to symptoms that you will develop, and that may prevent from this problem. Some medications are stopped during surgery. Medications are normally related to the healing of blood vessels and heartbeat. ACE inhibitors are given to keep the blood vessels well and blood pressure normal. Antiarrhythmic medications are given to keep the heart rate equal. Antibiotics are used to reduce the risk of infection. The anterior coagulants must be preserved so that the blood does not clot in the blood vessels and its circulation continues. Beta blockers are also given, which reduces the workload on the heart and help control the heartbeat. Diuretics and vasodilators are also given, which allows the vas deferens to drain out of the body and the opening and the closing of blood vessels. So friends, I hope this video is informative to you all. We will meet again soon with another informative video. Thank you.